Crisis control is all about helping our neighbors. We've got a lot of folks around us, sometimes surprising to meet them, that need help. And it's an opportunity for us to take resources that generous people have entrusted to us and help land them on somebody who really needs a helping hand.
I worked for like 15 years, almost 16 years driving a garbage truck. I owned my own home, had my own house, and I was like 25. And you know, we was financially straight. And I got sick, and my healthcare insurance only covered me for a year after I came out of work.
I was downsized on my job, and I was working another job part-time the entire time. They cut hours on the job, and so therefore I had house payment, car payment, gas, insurance, medicine, and I was like, well, if I get my medicine, I'm gonna have to maybe miss every other day so I can take my medicine. So I said, well, let me go to this crisis control and see what's going on, see if I can get some assistance.
People in need of prescriptions in our community can come to crisis control to get their medication filled. All they have to do is prove to us that they cannot afford those medications. Sometimes that may only be for 1 month, but if they need something every month, we have a program where they can be approved for 6 months to a year to get that medication, no questions asked.
It's striking how many folks just don't have another place to go to get basic medicines. And it's very sad when somebody who's got to control their blood pressure or needs an antibiotic and they don't have a place to go to get it otherwise. And the relief that people have when we're able to provide that need for them. And it's very comforting to think that they were able to get that medicine.
They make things sound easy when you get sick. They say, well, oh, your disability will be here in 30 days, and 30 days turn to 2 years, and 2 years turn to no check and no income and nothing coming through, and you just don't know what to think. You know, days you just sleep till you can't get out of bed. You just sleep, trying to just sleep the day away, and you know, your family, they can help you but so much, you know.
We have almost every life-sustaining medication that a person would need in our pharmacy. That ranges from the $4 generics you can get at Walmart to medications that cost people $2,000 a month. We help people from all different ranges because they may have no income, so even a $4 generic is an issue for them to afford. And of course, something that costs somebody $2,000 a month is going to really put a strain on their budget.
At the time, our medicine is 31 pills a day. My medicine was like 12 pills a day. And shots for the blood clots and Coumadin and all that.
A lot of our medication is donated from nursing homes, and that's how we're able to give so much medicine versus the small budget we do have. But anything that isn't donated, we can order in most cases.
Right now, even though that I'm on disability, but it's like $400 to get my medicine a month come out my check. You know, so some of my medicine was like $1,000, one medicine, and I can imagine what hers is.
Even when the medicine was $10, you know, I wasn't able to afford all of my medications. So if it hadn't been for crisis control, my life would probably be, I wouldn't be here. That's my belief.
We are a beacon of light in the community. We help people who need help, truly need help and have nowhere else to go.
But I just keep praying that things get better, you know, but God has really tested us. And it wasn't for y'all, I don't know where we'd have been.
I just love crisis control, and I love the people at crisis control. I really do. I really do.